Senator Murkowski.
Thank you, Mr. Chairman. Thank you all for being here. Dr. Christine, I just want to quickly follow on from my friend from Virginia and his request on long COVID and your views. You've indicated that you're continuing to collect data. If you would like additional data from the state of Alaska, I can certainly supply you with names of individuals who have presented these matters to me with great concern and a desire to understand more. I'm going to direct my first questions to you, Ms. Carey. I appreciated the fact that we had a chance to have some discussion yesterday. You've spoken here this morning about the issues with regards to staffing levels at the NLRB, kind of how we got there, and I think some constructive ways to how to approach it. Know that in my state of Alaska, this issue of this backlog and how long it is taking to process these claims, it matters. And so if I can urge you to pay attention to certain broader issues that are going to help us in Alaska, it's certainly on the issue of staffing and being able to address backlog. You have shared with me your belief that NLRB is an independent federal agent there to safeguard employees' rights, ensure fair labor practices. I appreciate that view, and also one that we discussed, which is your concern that we see a lack of stability really within the NLRB, where you have precedent that has been established over years, a withdrawal or a pullback from that, and the discussion about how we can focus more on continued or greater stability. I think that is going to be important within the NLRB as well. I mentioned to you, I am a Republican that has a good, strong relationship with labor in Alaska. I want to be able to continue that, and I think my ability to do that is when labor feels that the independent agencies are acting fair, that they're working to uphold the National Labor Relations Act fairly. One issue that I didn't raise yesterday was the fact that in my state we have about half the federally recognized tribes in the country. We have a number of tribes and Alaska Native corporations that operate both public and private sector enterprises. These are significant economic drivers for us, particularly in rural parts of the state. As NLRB's General Counsel, how would you approach questions of labor law as they relate to sovereign entities or complex jurisdictional questions, as we certainly have there in Alaska?
Thank you, Senator. I also enjoyed our conversation yesterday, and thank you for taking the time to meet with me.
Thank you.
So I agree with you, and as we discussed, the NLRB has been an independent agency since it was established in 1935, and any prosecutorial discretion that comes to me, I don't take lightly. In terms of jurisdictional issues, those are complex, but also guided by the statute. And, as I'm willing to take input and provide technical assistance to any questions that we have in relations to any potential jurisdictional issues, those are pretty fact-intensive and would require a little more than I can probably give here to you today, but I'm willing to work with you moving forward on those
well,
questions.
It's an important issue to us, so I'm happy to have more conversations with you about that. Dr. Christine, let me go back to you. And again, sticking with our Alaska Native constituency, the IHS provides critical health care to Alaska Natives, American Indian communities. Many in my state choose to compact their IHS funds to manage their own health care programs. The Alaska Native Tribal Compact tribally manages hospitals in Anchorage and Barrow, Bethel, Dillingham, Kotzebue, Nome, and Sitka. These are significant facilities. So I would ask for your commitment, if you are confirmed for this position, to ensure that we have true tribal consultation. I need you to champion robust tribal consultation policies across HHS that not only fulfill the legal obligations there, but really work to build out the collaboration that's necessary that respects tribal sovereignty in developing the health programs that impact our Native communities.
Yes, ma'am. And so, Senator Murkowski, thank you. And thank you for offering to have individuals from Alaska contribute toward gaining data.
Yes.
No, and absolutely, I want you to understand that one of the things that if I'm privileged to be confirmed, I'll oversee the Office of Minority Health. I take absolutely our indigenous and other individuals in the country who may have health discrepancies. I take that very seriously. And so I absolutely will be working with the Secretary, and I'm happy to be working with you to make sure that your indigenous tribes follow along with the rest of the country and become healthier than they've ever been.
Mr. Chairman, I have multiple questions. I'll submit them for the record.
Thank you.
Thank you.